Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Constipation. Introduction. Constipation means that a person has 3 or fewer bowel movements in a week. The stool can be hard and dry. Sometimes it is painful to pass. At one time or another, almost everyone gets constipated. In most cases, it lasts a short time and is not serious. There are many things you can do to prevent constipation. This program will help you understand constipation and what causes it. It discusses how constipation is diagnosed and treated. A special section on preventing constipation is also included. The digestive system. This section reviews how stools are formed in the digestive system. Swallowed food passes through the esophagus, also known as the feeding tube, and then through the stomach where it is partially digested. Digested food travels from the stomach to the small intestines, where nutrients are further digested and absorbed. Digested food that has not been absorbed in the small intestines reaches the colon or the large intestines. In the colon, the remaining nutrients get absorbed and stools are formed. Stools are then stored in the last section of the colon between the sigmoid and the anus before being excreted. What is constipation? Constipation is defined as having a bowel movement fewer than 3 times per week. Constipation happens when the colon absorbs too much water from digested food. This causes the stools to be dry and difficult to move through the colon. Constipation can also happen if the colon's muscle contractions are slow or sluggish, causing the stool to move through the colon too slowly. With constipation, stools are usually hard, dry, and small in size. This makes stools difficult to pass during a bowel movement. Some people who are constipated find it painful to have a bowel movement. Common symptoms of constipation include straining, bloating, and feeling as if the abdomen is full. Some people think they are constipated if they do not have a bowel movement every day. However, it is normal for a person to have bowel movements anywhere from 3 times a day to 3 times a week. Each person is different. Constipation is most commonly seen in women and adults ages 65 and older. It is also common in pregnant women. Almost everyone experiences constipation at some point in their life. Most constipation is temporary and not serious.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Causes. Constipation is most often caused by a poor diet. This includes a diet low in fiber or high in fats, such as cheese, eggs, and meats. Dehydration can also cause constipation. Not drinking enough liquid can cause dehydration. Also, some drinks can cause dehydration. These include alcohol and liquids that contain caffeine, such as coffee and cola drinks. A lack of physical activity can lead to constipation. For example, constipation often happens after an accident or during an illness when a person must stay in bed and cannot exercise. Constipation is also a common problem following childbirth or surgery. Constipation may also be caused by certain medications. Some examples include antacids that contain aluminum and calcium, antidepressants, blood pressure medications, medications that increase the production of urine or diuretics, iron supplements, pain medications, especially narcotics. Sometimes changes in life or routine may cause constipation. Pregnant women may be constipated because of hormonal changes or because the uterus compresses the intestine. Often, people become constipated when traveling because their normal diet and daily routine are disrupted. Aging can also affect the regularity of bowel movements. As people age, muscle tone decreases and the intestine becomes less active. If laxatives are used regularly, the body becomes reliant upon laxatives to have a bowel movement. In these cases, a person may become constipated if they stop using laxatives. Ignoring the urge to have a bowel movement can also cause constipation. Some people may delay having a bowel movement because they do not want to use toilets outside the home or they are too busy. Children may postpone having a bowel movement because of stressful toilet training. Diseases that cause constipation include neurological disorders such as strokes or spinal cord injuries, metabolic and endocrine conditions such as diabetes or hypothyroidism, systemic conditions that affect organ systems such as lupus. These disorders slow the movement of stools through the digestive system. Problems with the colon and rectum can also cause constipation. These include cancer, diverticulosis, Hirschsprung disease, intestinal obstruction, scar tissue, tumors. These problems can compress, squeeze, or narrow the intestine and rectum, causing constipation. Anorectal dysfunction, also called anismus, is another possible cause of constipation. Anorectal dysfunction results in the inability to relax the rectal and anal muscles. This prevents stool from leaving the body. Diagnosis. Most people with constipation do not need a lot of tests to be diagnosed. For example, in young people with mild symptoms, a medical history and physical exam may be all that is needed to diagnose constipation. A physical exam may include a rectal exam with a gloved, lubricated finger. A rectal exam checks muscle tone, as well as signs of tenderness, obstruction, or blood. In some cases, lab tests may be necessary to rule out certain disorders that can cause constipation. These can include blood and thyroid tests. Some people with severe symptoms may need more extensive testing. Examples of severe symptoms include sudden changes in the number and consistency of bowel movements, weight loss, or blood in the stool. A colorectal transit study may be done to see how fast food moves through the colon. During this test, the patient swallows capsules containing small markers that are visible on an X-ray. Multiple X-rays are taken 3 to 7 days after the capsule is swallowed to see how well the colon is working. To diagnose constipation caused by abnormal functioning of the anus or rectum, anorectal function tests may be done. These include anorectal manometry and balloon expulsion tests. The cause of constipation may also be diagnosed using barium enema X-rays. Liquid containing barium is inserted into the rectum for this test. The barium makes the rectum, colon, and lower part of the small intestine visible in the X-ray images. A sigmoidoscopy or colonoscopy may also be performed. A sigmoidoscopy examines the rectum and lower or sigmoid colon. A colonoscopy examines the rectum and entire colon. Both use a thin, lighted tube inserted through the rectum. A biopsy may be done during either a sigmoidoscopy or colonoscopy if abnormal tissue is found. A biopsy is a removal of cells or tissue. The sample is then examined under a microscope. Treatment. Treatment for constipation depends on the cause, how severe the symptoms are, and how long the constipation lasts. However, in most cases, dietary and lifestyle changes will help relieve symptoms. A high-fiber diet helps the body form soft, bulky stools that are easy to pass. High-fiber foods include beans, whole grains, fresh fruits, and vegetables. A doctor or dietitian can help you plan a high-fiber diet. Other lifestyle changes that can help treat constipation include drinking enough water and other liquids, engaging in daily exercise, not ignoring the urge to have a bowel movement, reserving enough time to have a bowel movement. If diet and lifestyle changes do not help, a doctor may recommend fiber supplements, laxatives, or enemas for a short time to treat constipation. Follow your doctor's directions. Taking laxatives for too long can cause dependency and lead to constipation. If your constipation is caused by a medication, you may need to stop taking or change the medication. Do not stop or change medications without the advice of your doctor. If your constipation is caused by structural problems or blockages in the digestive tract, then surgery may be needed. If the cause of constipation is weak muscle control, Biofeedback may be used to retrain the muscles that control bowel movements. Biofeedback involves using a sensor to monitor muscle activity, which is displayed on a computer screen. A healthcare provider uses this information to help patients retrain their muscles. Prevention. Almost everyone experiences constipation at some point in their life. This section discusses tips to help prevent constipation. Eat a well-balanced, high-fiber diet that includes beans, bran, whole grains, fresh fruits, and vegetables. Fiber is used by the body to add bulk to stools. This prevents hard, dry stools that are difficult to pass. Avoid foods that have little or no fiber if you have problems with constipation. Some examples include ice cream, cheese, meat, and processed foods. Drink plenty of liquids. Drinking water or juice adds fluid to the colon and bulk to stools, making bowel movements softer and easier to pass. You should also avoid alcohol and drinks that contain caffeine, as these will cause you to become dehydrated. Exercise regularly. Although doctors do not know precisely why, regular exercise can help prevent constipation. Set aside time for bowel movements. Some people may become constipated because they are uncomfortable using the bathroom in public places, or they are constantly busy. Making time to have a bowel movement is important in preventing constipation. Do not ignore the urge to have a bowel movement. If you do, your body may eventually stop sending you these messages and you can become constipated.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary.
Constipation means that a person has 3 or fewer bowel movements in a week. At one time or another, almost everyone gets constipated. In most cases, it lasts a short time and is not serious.
There are many different causes of constipation. Poor diet, dehydration, and lack of exercise most often cause constipation. In most cases, dietary and lifestyle changes will help relieve symptoms. Laxatives may be prescribed for a short time.
Constipation may also be a sign of a more serious problem. In these cases, more extensive testing may be needed to find the cause of constipation, and treatment is aimed at the specific cause.
Understand that normal bowel habits vary. However, if you notice a sudden or lasting change in your bowel habits, you should talk to your healthcare provider.
Thank you for using Explain.